Good evening, everyone. Michael Soothing here. I wanted to do something a little bit different tonight. As a follow-up to my doctor role play, very scratchy voice tonight. I've told you in some of my past videos that I will explain why I can't remember anything these days. As far as short-term memory, long-term memories, yes. I can tell you what I had for dinner on March 17th, 1971, but I can't tell you what happened today or yesterday or the name or title of any recent movies, songs, actors, actresses, etc. Now, I very much suspect, in fact, I'm quite certain, that I'm suffering from a type of early onset Alzheimer's disease. And that's no joke. It's very serious. My short-term memory is so bad that I can walk into, say, the kitchen to get some. You've all experienced this. You walk into a room, you forget why you're there. But for me, this happens, say, 4 or 5 times in a row for the same thing. Say, I walk in to get a bottle of water from the refrigerator. I keep cold water there. And I forget why I walked in there. So I go back to my living room or wherever. And then I think to myself, I need to go get a bottle of water because I'm thirsty. And I go in there and I realize it's the second trip. But I forget by the time I get there what I was doing, okay? And this can happen 3, 4, 5 times. Now, all is not lost. This problem is also affecting certain parts of my cognition, not analytical skills, not reasoning skills, not logic circuitry, but some of my vocabulary has been erased, as if somebody went in with a little probe and erased, say 10 or 15% of the vocabulary words I used to know, maybe 20%. They're there, but when I'm trying to call one up, I know what the word means, I know it's there, but I can't access it. It's like there's a wall between that vocabulary memory module and my neurocircuitry that's trying to pull that word up. And I've made a long list of all the problems associated with memory that have come on me the last year or two. The reason I'm bringing all of this up is not for the sympathy vote, but to explain as a public service there are ways to combat this. And I'm quite certain that the reason I'm having this problem is directly related to type 2 diabetes, because what the latest research has found over the last 10 years or so is that for people who have early onset Alzheimer's symptoms beginning, a subset of those people are having those symptoms because of type 2 diabetes. In the doctor role play that I did before this video, I explained some of the horrors of what can happen if you leave your type 2 diabetes untreated. However, if you aggressively treat it, and that's why I'm doing this video, if you aggressively treat that disease, you can reverse the effects or at least arrest the effects. And that's what I'm going to try to do as far as the memory issues and the early onset Alzheimer's. I have here, so I'm going to share with you. Of course, I'm not a doctor. I'm not a medical practitioner. I used to be in rocket science, and I was having difficulties there because of this problem. I spent, 40 some years of my career in aerospace. And so when I left that just a few months ago, part of the reason was because of this problem. But I take those particular skill sets and that way of thinking, the scientific approach, and I've done a ton of research, and I want to share it with you. And if anyone out there knows someone, or maybe they themselves have experienced something like this may benefit them. If you don't know anyone like that, or you're not having the problem, you might file it away for future reference, or you can just go to sleep to my voice. But I wanted to share with you the results. World Journal of Diabetes, see? But this entire paper is actually an accumulation of papers where they've gone into tons of research papers and studies and then done a cumulative summary to explain the molecular and biochemical trajectories from diabetes to Alzheimer's disease and what might be done to treat this problem, okay? So I'm going to read you a little bit of it. If I bore you to death, then that's okay too, because you can go to sleep to the sound of my voice. By the way, I want to read you something to show you the real world results. I have here a message one of my subbies sent me, and I asked her permission to read this. Her name is Vicky, and she recently lost her husband. So our prayers are with you, Vicky. And she lost her husband to complications associated with type 2 diabetes. And he was not an old man, he was a fairly young man. I'm going to read you what she says, even if I have to do this video in 2 parts perhaps. And then you'll understand why I'm doing a serious discussion tonight. She says, her and I were having a bit of a dialogue on the short-term memory issue and diabetes, and she said, my husband started losing memory gradually. He would forget names of celebrities or political figures. Exactly the problem I'm having. He would describe things about the person he was trying to think of their name until I guessed the name for him. That is exactly what I have to do now. Whoever's around me, I say, oh, you know that guy with the big jolly cheeks that was in The Godfather, right? And they'll go, oh, Marlon Brando's who you're trying to think of, right? I have that written down here, or I probably wouldn't remember his name. Anyway, that's what she was doing with her husband. He was having this exact problem. He would say, I forget, or I don't remember, words he used more and more as time went by. We used to joke around about it. I recall telling him, this is in regards to the Jodi Arias trial and the famous prosecutor Juan Martinez. I did a long series of videos on that on a different channel, okay? I recall telling him, Juan Martinez would have a ball with you on the stand, right? He was a very active, that's Vicky's husband, a very active 56-year-old man, so I didn't think too much of it. His type 2 diabetes was under control with weight loss medication and a strict diet, which is what I'm trying to do now, strict. He went into the hospital for a minor procedure this past January, and everything started snowballing. He had a dry, cracked heel on his foot that would not heal, and gangrene set in, so they amputated his foot. Remember, I said in the doctor role play, you start losing your feet first in diabetes if you leave it untreated. The nerve damage, the neuropathy, is what creates this problem where you can't heal foot sores, for example. Antibiotics and dyes for various tests were straining his kidneys. Kidney failure is another problem associated with diabetes, as is stroke, by the way, which I left off my list when I was doing the doctor role play. His amputation wasn't healing. More infections and more antibiotics and more dyes. Another surgery was required to amputate below the knee. Are you getting the message? This guy's being taken apart piece by this terrible disease. He became confused and disoriented from the toxins building up in his blood. Dialysis was needed. He was left on a bedpan for many hours. He didn't have the mental ability to ring the nurse for help. This created a horrible pressure sore, from laying in bed for a long time, which needed painful debridement every day. I could go on and on. His inability to sit or stand exacerbated his cardiovascular issues. Dialysis was needed. We said that. His lungs were diminishing. He needed surgery to remove his gallbladder, but he was not a surgical candidate, so a tube was placed to drain the gallbladder. It was intubated and extirpated 4 times during his 7-month hospital stay. I traveled back and forth 2 hours almost every day to be with him, and have to say, as hard as all this was for him and for us, his family, to experience, the worst part was his inability to express himself and seeing the frustration on his face. We, his family, encouraged him to fight so that he could go to a rehab center and learn to walk with a prosthetic leg. He never gave up. From the start of all of our prayers, we were praying for a miracle. Those prayers changed, however, to asking God to do what was best for him. In the end, he contracted a deadly infection called CRE. What I wanted to say is 2 things. The first being that if my husband had been more vigilant earlier on, when he was diagnosed as pre-diabetic, then maybe things would not have gotten so out of control. The second is that I agree with you 100%. The loss of mental cognition was the most terrifying of all for my family, and I'm sure for my husband. See, that's what terrifies me more than anything else. Any other kind of medical problem or issue. To me, it's more frightening than cancer or virtually any disease, is to have your mind taken away from you and your body still lives on. So I have a very active intellectual life, and I can't abide the thought of losing that, or not recognizing, the people around me, like my family. Some people have compared, I've seen a neurologist compare Alzheimer's and dementia to a broken grand piano that the master musician might want to sit and play it, but you're not going to hear any notes come out because, the piano is broken. In the same way, we don't lose ourself necessarily through dementia or Alzheimer's. Our self is still buried in there someplace, but the brain is the instrument for expression. And if it's damaged, you may lose the ability to do that expression. So, thank you, Vicki, for sharing that very difficult story. Vicky told me I could use that because if there was any possibility that even one person could be helped by taking prediabetes seriously, then she wanted her story told. And so that's why I told it. Now, what can we do? What are the causes? They're not totally understood. And I may do a more in-depth video in the future on why diabetes creates this problem with cognition and short-term memory and dementia and Alzheimer's. But basically it comes down to this. It's an insulin resistance problem in the brain. And in type 2 diabetes, insulin fails to stimulate the utilization of glucose. Glucose is the food that your brain feeds on. And this gives rise to a phenomenon called IR. That's insulin resistance. Chronic IR leads to several complications: lack of cellular energy, cardiovascular problems, plasma lipids, increased risk of developing dementia and Alzheimer's. Has been supported by clinical and epidemiological studies. Okay, learning and memory is dependent on insulin. It regulates the release of neurotransmitters and synaptic plasticity. Synaptic plasticity means the synapses are the part of your brain that's transmitting all of information throughout all the neuron network in your brain, which is several trillion cells, I believe. And if those transmitters lose their ability to be plastic and versatile, then signals can get blocked, see, and then you can't get access to, say, your memory for names or titles, things like that. It is referred to in the literature that defective insulin signaling in diabetic patients plays a crucial role in synaptic physiology. This is a long paper, but I'm not going to read it all to you. I'm going to read a couple highlights to help you understand this problem. You may end up recognizing it in someone you know in your family or a friend. Diabetes mellitus is metabolic disorder characterized by hyperglycemia. The complications include diabetic nephropathy, neuropathy, and retinopathy, which we talked about a little in the doctor role play. And these will be dependent on the severity of the hyperglycemia. A sorbitol accumulation starts occurring in the pathways and leads to osmotic stress. Osmotic stress is when you can't get rid of sorbitol, which is being created in your system because of this inability to process insulin. Clinical and experimental studies suggest a strong association between diabetes and cognitive impairment. Remember, I told you I'm having trouble with memory sometimes. When I do a video sometimes, I'll have an outline of what I want to talk about. If it's not a pure ramble, I may have an outline of something, but I forget parts of it. So often I'll say, we'll get back to that in a minute, and I never get back to it because I forget that I told you I'll get back to it in a minute, see? So if you notice that in my video from time to time, give me a little slack, okay? The hallmark symptoms of the disease are polyuria, which is excess urination, polydipsia, which is thirst, polyphagia, which is increased appetite. Remember, we talked about all those. And all this stuff can lead to oxidative stress, a boosting in your system of something called ROS, reactive oxygen species. Those are those little free radical type things that can do a lot of damage neurologically to you. This goes on about how Alzheimer's can sometimes be called type 3 diabetes because of the fact that you're not able to process insulin. And it can become a vicious downward spiral. I even drew a little graphic here when I was trying to explain what was happening to me to someone. Where is the little graphic? There's the little graphic, the downward spiral. I highlighted a lot of passages and concepts in here that I wanted to understand better as far as what causes the... But anyway, the vicious cycle is that you can have inflammation that causes oxidative stress, and that impacts your glucose metabolism and contributes to Alzheimer's disease as well as dementia. And then it feeds on itself. It's like the diabetes gets worse, and that makes the oxidative stress worse, and the cognition gets worse, and it's just a downward. But all is not lost. If this sounds depressing for somebody with the disease, I could get depressed, but I'm not going to, because the light at the end of the tunnel with this big research paper is that there are ways that you can self-treat that are quite effective in most people. There's a chicken and egg question, they say. What came first? Because these two diseases feed on each other. Sometimes Alzheimer's leads to type 2 diabetes instead of the other way around. I'm not going to get into some of the very technical medical jargon unless some of you want me to do a follow-up. If you request one, I'll do a more detailed review of all of this research that's summarized in this paper. But for the layman, see, there's all kinds of diagrams on what the cascade chain of events becomes for someone with type 2 diabetes who's suffering from early onset Alzheimer's. There are several types of flow diagrams that help explain this in not particularly layman accessible medical and scientific terms. I had to read through this research paper summary about 8 or 9 times, and I'm fairly well educated, but I had to look up a lot of the terms to understand them better and put definitions in, so that I could go back and understand it as I read it. But anyway, some of the key concepts of how to treat this is you have to reduce reactive oxygen species. That's one thing. You need to use therapies that will help you convert and use the glucose. It talks here about insulin receptors and memory formation. This gets into a lot of excellent detail on the actual memory problem caused by the insulin receptor problem when your insulin receptors in your brain are not working well and you're insulin resistant, and how that affects memory formation. We have another good flow diagram here that discusses some of that cascade. Then this gets into a highly technical discussion of FOXO1 signaling and oxidative stress pathways. Oxidative stress imbalance once again leads to that downward spiral that I show, which may look a little like a tornado. And it has to do with these, again, free radical type reactive oxygen species and what they do to certain pathways in your brain. By the way, all of this research is based on good, double-blind medical studies. None of this is, nonsense that was made up by somebody who's trying to sell you magic water like ASAE or something like that, or some crank homeopathic remedy or something. This is all very well done research. Here's another diagram that summarizes how the reactive oxygen species, type 2 diabetes, hyperglycemia, and Alzheimer's all fit together and interact with each other in a causal sort of way. And yet another diagram that discusses things like insulin resistance, glucose utilization, and the blood-brain barrier. So we have that. I'm going to tell you the name of this when I'm done, so you can look this up if you want to read all of this for yourself. Again, inflammation is a huge problem. I actually take sometimes an anti-inflammatory, but that doesn't really help with this problem. It helps with back pain and things for the most part. Oxidative stress, mitochondrial vulnerability. I'm going to cut to the bottom line. There's more discussion of the neurobiology of glucose utilization. But I'm going to cut to the bottom line and start talking about some of the best therapies. I'll start with one that I'm familiar with because I have a prescription for this medicine. It's the only medicine I have a prescription for. I don't take anything else, and at the moment I'm not taking even this because I'm not tolerating it well. So I want to try, and that's called metformin. Metformin. Now what metformin is designed to do is to lower your blood sugar. The technical term is that it's basically a sugar eater, if you look at the Latin terminology behind it. It's used to reduce insulin resistance also. It sensitizes liver and skeletal muscle. It can actually make you feel sore and tired. That's one of the problems I have with it. But it helps with oxidative stress. And it turns out it promotes insulin action, attenuates the molecular and pathological features observed in Alzheimer's disease. And it was found to reduce the risk of dementia in human subjects. Alzheimer patients taking calcium in diet supplemented with metformin were found to have better cognitive performance. Now, I've read this in several other places as well. And so, what my plan is to try to get back on the metformin, but take a very small dose and very slowly increase it and see if I can tolerate it better. That's now they discuss some other types of medications in here. And I'm not going to go into all of them because the metformin seems to be the most effective. But in people with advanced Alzheimer's and diabetes, there's things like intranasal insulin, which apparently helps with processing glucose for the brain and helps with cognition. What I want to get onto, and there's a lot of information on the clinical studies done, some of the other drug therapies that have been at least partially effective or shown some effectivity. But what I want to get onto is the lifestyle changes that a person can make. And Vicky's story, coupled with my research and the symptoms I'm seeing in myself, and please, that is, requests from loved ones that I treat this aggressively, have led me to, and of course, information from my own doctor as well, all indicate that there are some things you can do that are very helpful at arresting, even curing type 2 diabetes, and this should completely arrest, at least that's my hope, completely arrest the progression of cognitive decline and memory decline. What are these lifestyle changes? They're things that just make practical sense, of course. But here's what they are. Here are the therapies. Exercise multiple times a day. It's not enough to take a 2-mile walk in the evening. It'd be better to take a 1-mile walk in the morning, in the afternoon, and in the evening. Or, let's say I wanted to walk 3 miles a day, right? The best thing to do would be to break that up into 3 1-mile walks. And the reason for that being, there's multiple reasons, but your muscles are helping to burn up that glucose in your system when you're doing that. And so it's going to keep your blood sugar at a proper level and stave off the diabetes symptoms and progression. Proper nutrition, of course. Low carb, low glycemic, low sugar. I'm not supposed to be eating bags of potato chips. I'm not supposed to be eating, a lot of bread. Certainly no cookies and candy and, cakes and things like that. Sweet rolls, potatoes, French fries. Supposed to avoid all that stuff now. Does that mean I can never have something I like? No. But if I have something I like, let's say I have a cheeseburger, right? All right. Well, the beef is okay. A little fatty, but it's okay. I have good cholesterol. Same with the cheese, the dairy, the protein. But the bun is not so good. And it's a little high overall in calorie. If I go walk afterwards, it's not going to impact my blood sugar in a negative way to have that cheeseburger, because I'm going to pay for it by burning it off. I know this through my own blood sugar testing and monitoring. If I eat a Big Mac and fries, no soda, I don't have soda, okay? That would really be bad. It's loaded with sugar. High fructose corn syrup that instantly turns into virtually instantly becomes high blood sugar, glucose in your system. If I was to have a Big Mac and fries and then test my blood sugar an hour later, right? It might be 160 or 180. That's too high. However, if I was to eat that same Big Mac and fries, go out for a long 2-mile walk, then test my blood sugar an hour after eating, it's gonna, excuse me, fall allergies. If I take that walk, then my blood sugar will be, instead of 180 or 170, it's going to be 120 or 130, which is fine. So that's a very important therapy, the nutrition. And of course, you're supposed to eat things like for Alzheimer's and dementia, as well as for your overall physical health. These are the things that boost acetylcholine, which is extremely important. You need choline to have proper neurological functioning and cognitive functioning. And you can find that choline in the following type of nutritional substances. Wheat germ. Here's a surprising one. Egg yolk. And by the way, for a type 2 diabetic, it's perfectly fine to eat a couple of eggs each day. They're high protein, virtually no sugar, okay? Some reasonable fruit, high fiber fruit, just not too much at once. Nuts of many kinds and seeds of many kinds have choline. Antioxidant berries like blueberries, raspberries and things, and of course veggies, especially dark green leafy veggies, and carrots. Things like kale are good for you. All of these are important as a part of an anti-diabetes, anti-Alzheimer's regimen. So we talked exercise and we talked nutrition. What's next? Supplements. Vitamin B12. Actually, we've talked three things already, haven't we? Metformin, exercise, and nutrition. Three things. Now we'll go to the fourth. Supplements. Vitamin B12 is very important, and it's water soluble. It's hard to overdose on it. There are virtually no negative side effects, unlike with other vitamins. You can have some very negative effects from taking too much vitamin A or E, for example, but not B12, and that helps with a number of things. But you should take the right kind of B12. It's very important. Not every B12 is alike. 95% of the multivitamins and single vitamins that say B12 are cyanocobalamin, and that's not the right kind. What you want is the natural kind that's vegan. Methylcobalamin is what you want. Look on the label and take 500 milligrams or more a day. It will help you with cognition. It will help you with certain types of back pain. And I remember reading several kinds of studies in my research. Now I can't recall the memory thing. I can't recall what other things are treated with B12, but it has a very positive impact for some other things. Another important one is vitamin D also. So you want your vitamin D. And again, if the vegan form is available, that would be better than the lanolin form that comes from animals. It's more effective. It appears that vitamins C, A, E, and lecithin in combination, in moderate doses now I'm saying, okay, not mega doses, those are helpful for cognition and for prevention. They have some indication of helping with Alzheimer's. Certain enzymes would be the next. That would be catalase and peroxidases, those two enzymes. Repeating the meds, the one med that's the most effective is metformin in combination with calcium. There's one other medication I'll mention that seems to have a good, strong correlation to helping, and that is rosiglitazone. rosiglitazone, Rosiglitazone. Metformin is spelled Metformin. For calcium, you know what I do? I just take a Tums because that's an easy way to absorb calcium. And, okay, I'm going to read you the conclusion of the paper. We skipped about 98% of the verbiage in it because it's pretty technical and slow going, but the conclusion is, this is a synopsis in which metabolic disturbance becomes indispensable for life. This is a metabolic problem that emerges as a molecular signal defect and takes the form of a syndrome with multiple complications. Type 2 diabetes to Alzheimer's disease with multiple divergence and convergence. In other words, the two work together somehow to take you down. AD and DM are two devastating syndromes with complex molecular interplay, evidence of their shared molecular and biochemical footprints, and is in this paper. So, just to repeat the therapies one last time, you want to take good exercise, say 3 times a day if possible. If not, do it twice a day, but it's better to spread it out. That way you'll keep burning glucose. Nutrition, the things we talked about. Get your choline levels up with wheat germ, egg yolk, fruits, vegetables, nuts, seeds. Take antioxidant berries and things for your cognition, and supplements. The most important one is probably B12, but vitamins C, A, E, and lecithin are good also. There's a couple of good enzymes, catalase and peroxidases. And if all else fails, combine all this with a medication like metformin. Again, the disclaimer, I am not a doctor. I am not giving you medical advice. I'm giving health advice that one guy is doing after a lot of research. This isn't the only paper I've got, the only one I've read. I've gone through many dozen, okay? So, I hope that this word of warning will help some person out there who's struggling with diabetes. And if you start having muddled thinking or difficulty with memory, take that diabetes very, very seriously and get very aggressive about treating it. Otherwise, you might lose your marbles. And none of us want that for you or for me. How am I going to do videos for you good people, my great subbies that I love, if my brain isn't functional anymore and my cognition is gone? So that's why I diverged from my normal protocol, my normal genre, to do this serious message tonight. I hope that if you have no use for it medically, at least my voice was soothing enough to put you to sleep. All right? That's it for now. I am going to probably discuss this issue again in the future sometime. I'll let you know, for example, how it's working for me, the therapies that I'm going to do and that I'm going to pursue with zeal. Those of you who've watched for a while know I'm already doing these things. I've already lost some weight. I've already gone on a healthier diet and exercise program. But I'm going to ratchet it up 3 notches now for a lot of reasons. I have a future life I want to enjoy in Oregon. I don't want to have happen to me what happened to Vicky's husband. I want to enjoy people I care about in the future. I want to reach people through with help and with ministry and other things. And I have all that planned ahead, so I'm going to get super aggressive and take it up a notch as far as treating this thing. I hope it wasn't too self-indulgent of me, but I don't mean it that way. I mean this as a message that could help someone. So until next time, we'll lighten it up again in the next one. But don't ASMR and drive, okay? Just don't. All right. Bye-bye.